Okay, so I don't think there's going to be loads on this first slide that's particularly surprising to anyone here. We know that every single year we have a ton of students coming into higher education, and we know that with them we're going to have tons of challenges that they bring and that they encounter when they enter our space. We know this from ISSE data, other surveys like My World, which has been mentioned as well. We know that students consider withdrawing. We know that they feel under-supported, particularly in areas of well-being and health. We also know that this disproportionately impacts some groups more than others. We know this happens every single year. We know that they're coming. So it brings us challenges. All of our universities and institutes of further education have lots of student support services that are really robust, provide a lot of value to students, but it can be challenging for students to access them when they're going through whatever issues they may be experiencing in that well-being space. They might not actually be able to reach out at that present moment, so all those wonderful services get underutilized. So we've leaned hard on the HEA and used a lot of their guidance in terms of using the suicide prevention framework, using innovation transformation funding, using the National Forum's guidance around learning analytics to see what we can identify in terms of how students might be disengaging early, what behavioral markers we might be able to identify and do something about so we can be proactive. So instead of generically signposting, we can reach those at risk when they need it. So that's what it looks like. So basically, we had our aim, approach, and assumptions, basically. So we wanted to be able to better integrate our support networks with students as they're becoming at risk. We wanted that support to be targeted as well. In terms of our assumptions, we looked at the virtual learning environment. We assumed that student engagement with their class materials online. We use Brightspace. I'm sure a lot of you do as well. Could be Blackboard, could be Moodle, any of those. We assumed their engagement would be reflected there, and if they were disengaging, that would have a downstream impact on their assessment and retention, progression. All of that would feed from there. So if we could identify that disengagement early, we could mitigate that a little bit. So there's some detail there on how we flag students. It's not massively complex by any means, but it's consistent across the university in terms of how we look at those thresholds. So we know it works, and we know it works well. Students that go throughout their lives never being flagged as at risk have fairly good progression outcomes in GPA attainment. If you're flagged by LEAP, you probably are on the way to having slightly worse progression outcomes. So thankfully, it does look like those students that are being accurately identified and avail of support have outcomes. That purple bar there in the middle, a little bit closer to where the rest of their peers are at. So again, we know it works and we know it works well, but one question is those at-risk groups I mentioned at the start is if we're actually getting those as well. And the short answer again is yes. So I know there's a lot of noise on this slide. So if you just look at the colors, so this is just looking at our access pathway students and our international students. Access is green, international students are blue. If you assumed an even level of risk compared to the overall population, all of those bars would be a nice even bar across. But that's not what we're seeing. We're seeing that the students from those groups are being identified as acutely at risk more often than their peers. And the promising thing is that those that are flagged as acutely at risk are getting that support from LEAP, and that black bar at the very end, that acute risk flag, is actually depressed in terms of their progression risk, that they're actually closer in line to their peers that were never flagged by LEAP than those that might be mildly at risk. So we know that the people that are getting that support are actually benefiting from it in some way. That's great, wonderful, but then there's the and so what for you guys, right? So because we know LEAP has worked well, UCD is looking at other types of engagement that we might be able to identify as a way to do something else proactive in a similar space. So looking at library access data, clubs and society memberships. And what we're pleasantly surprised to find is that it looks like a lot of that engagement is connected regardless of where you're drawing it from. So what it means for everyone else is that rather than having to build some giant VLE engagement system from scratch, what you can probably do is find something that you can use that's real time and extrapolate pretty accurately from there to do something proactive in your institutions as well in the space. So that's it from me. Thank you very much.